Do you wake up 2 or more times a night to go to the bathroom? Do you think it's just old age? I'm here to tell you. As a doctor with over a decade of experience, that's not entirely true. This nighttime urination is called nocturia, and it affects over 50% of adults over 65. But here's the problem. Nocturia isn't a normal part of aging. It's a warning sign. It can mean your body is holding on to too much fluid at the wrong time. Your kidneys aren't following their natural 24-hour rhythm, or your brain isn't making enough of a hormone called vasopressin, which tells the body to hold water at night. And every time you wake up to pee, your deep sleep cycle breaks. That's the part of sleep that helps your brain repair, your muscles strengthen, and your heart rest. Now think about what happens if this keeps going for years. Brain fog, increased fall risk at night, poor blood sugar control, and even a 28% higher risk of early heart disease in seniors with frequent nocturia. Most people try to fix this by drinking less water. That's the wrong solution. The real fix lies in when and how you drink water, not just how much. And in this video, we'll walk through the 5 best times seniors should drink water, backed by science, to reduce nighttime urination and get peaceful, unbroken sleep again. This advice can change how your body sleeps, heals, and functions, and it might be the missing piece in your health puzzle. But first, let's understand what your bladder and kidneys do while you sleep. Medical disclaimer: this video is for informational purposes only. Always consult your physician or a licensed healthcare provider before making changes to your hydration, supplements, or sleep routine. The role of your kidneys and bladder while you sleep. Most people think their kidneys shut down while they sleep, but the truth is they're still working, just in a very different way than during the day. Here's what should happen at night. When the sun sets and your brain detects darkness, it signals your body to slow down. One of the most important signals comes from your pituitary gland, which releases vasopressin, the anti-peeing hormone. This hormone tells your kidneys, hey, it's nighttime, stop making so much urine. So instead of constantly filtering water out of your blood, your kidneys slow down, and your bladder holds on to more fluid without triggering the urge to go. But for seniors, this rhythm can break down. Why does this happen? Lower vasopressin production. As we age, the body makes less vasopressin, especially after age 60. That means the kidneys don't get the message to slow down, and they keep producing urine all night. Bladder changes. The bladder muscles can weaken. The nerves that control bladder fullness may become overactive or confused. Even a small amount of urine might now trigger a powerful urge to go. Medications and hidden conditions, diuretics, heart medications, even mild diabetes or undiagnosed sleep apnea can confuse this nighttime system. Your kidneys don't know it's night anymore. Chronic dehydration during the day. Many seniors drink too little water during daylight hours. This creates a rebound effect. The body overreacts at night, pulling fluid out of tissues, causing nighttime urination. So if your body thinks it's still daytime, it'll act like it, and your sleep will suffer. The good news? You can retrain your internal rhythm, not by drinking less, but by drinking smarter and at the right times. That's what we'll explore starting in the next chapter. The hidden hormone disruption that triggers nighttime urination. If you're over 60 and waking up at night to urinate, your body may not be broken, but one small hormone might be out of sync. That hormone is called vasopressin, and it's one of the most overlooked causes of nocturia in seniors. So what exactly is vasopressin? Vasopressin, also known as antidiuretic hormone, ADH, is produced by your brain. Its job is simple: to signal your kidneys to hold on to water and stop making urine, especially while you sleep. In young adults, vasopressin levels naturally increase in the evening. That's what allows them to sleep 6 to 8 hours without waking to urinate. But here's the issue. After age 60, vasopressin production can decline by up to 40%, especially in people with mild cognitive decline, low melatonin levels, or poor hydration rhythms during the day. And when vasopressin is low at night, your kidneys don't slow down. They keep making urine as if it's the middle of the afternoon. That means your bladder fills faster. The signal to wake up comes earlier, and your sleep is broken repeatedly throughout the night. The worst part? You might not even feel fully awake, but your brain enters what's called light sleep arousal, a half-awake state that blocks deep sleep, messes with memory formation, and increases inflammation in the body. Over time, this hormone imbalance can lead to daytime fatigue, mood swings, increased blood pressure, and a much higher risk of falls, fractures, and mental confusion. But here's the good news. Your vasopressin rhythm can often be gently restored, naturally, by drinking water at specific times during the day. That's what we'll explore in Chapter 4. Before we go there, let's identify when not to drink water, because poor timing can make this hormone imbalance even worse. The worst times to drink water. You're probably doing this. Most seniors who struggle with nighttime urination are told to just drink less water, so they start skipping fluids in the evening. Some even stop drinking water after 5 p.m. altogether. And yet, they still wake up 2 or 3 times a night to urinate. Why? Because it's not just about how much you drink, it's about when you drink. And unfortunately, many seniors unknowingly drink at the worst times for their body's natural rhythm, especially after 60, when hormonal balance is already delicate. Let's talk about the 3 most harmful times to drink water if you want deep, uninterrupted sleep. 1. Right before bed, 30 minutes or less. This is the most common mistake. Many seniors take their medications at night and then follow it with a full glass of water, sometimes right before lying down. Then, around dinner time, they suddenly remember and start chugging large glasses of water. This overloads your kidneys during the wrong part of the day. Instead of filtering and storing fluids slowly during daylight hours, your body now has to work overtime after dark. That leads to increased bladder pressure, frequent nighttime urination, disrupted hormone rhythms. Tip: you cannot catch up on water intake in the evening. It only worsens nocturia. Now that we've covered when not to drink, we're ready to talk about what really works. But your kidneys don't have time to process that fluid. Within 1 to 2 hours, it ends up in your bladder, right in the middle of your first deep sleep cycle. That's when you wake up. Tip: if you must take nighttime medications, ask your doctor if they can be moved to an earlier hour, or see if they can be taken with a smaller volume of water. 2. In the middle of the night. It's 2 a.m. You've just returned from the bathroom, and you feel a little thirsty. So you sip half a glass of water, thinking it will help you fall back asleep. But now your kidneys start up again. That one small glass may send you back to the bathroom around 4 a.m., blocking you from reaching deep REM sleep, which your brain desperately needs to heal and reset. Tip: if you feel thirsty at night, it's often a sign you didn't drink enough earlier in the day. 3. Chugging water in the evening to catch up. Many people don't drink enough water in the morning or afternoon. Best 5 times to drink water for deep, unbroken sleep. Now that we've explored what not to do, it's time to shift focus. Instead of avoiding water, we're going to strategically time it so your kidneys are hydrated early, your bladder is calm at night, and your brain gets the rest it needs. This is what I recommend to my senior patients and what the research supports. These are the 5 best times to drink water if you want to rebalance vasopressin, reduce nighttime urination, and finally sleep through the night. Let's begin. Time number 1. Within 30 minutes of waking up, your kidneys are most efficient in the morning. Drinking 8 to 10 ounces of water shortly after waking rehydrates cells after sleep, kickstarts digestion and metabolism, helps your body begin the fluid balancing cycle earlier in the day. Most importantly, it tells your brain, the day has started, begin your circadian rhythm. This also reduces the chance of late-night thirst. WT, time 2, 30 minutes before breakfast. Because drinking water too close to dinner leads to increased fluid retention, especially in older adults with slowed digestion. But if you drink water 2 hours before your evening meal, you boost digestion, support your kidneys while they're still active, and give your body enough time to process that water before sleep. That means less pressure on your bladder later in the evening. Time number 5, between 5 p.m. and 6 p.m., your final glass. This is your cutoff window. Your final glass of water, no more than 6 to 8 ounces, should be taken before 6 p.m. if possible. This allows full absorption by 8 p.m., proper kidney filtration, and minimal bladder activation during sleep. Think of it like dimming the lights before bed. You're telling your body the day is winding down. If done consistently, this step can reset your hydration clock within 7 to 14 days. Key reminder: hydration is not just about quantity, it's about timing. By following this pattern, you teach your brain and bladder to rest when you do. The result? Longer sleep cycles, fewer wake-ups, better energy, and improved heart and brain health. Next, we'll explore what kind of water is best and what to avoid, especially if you have muscle cramps, high blood pressure, or poor circulation. Many seniors sip coffee or tea with their morning meal, but skip plain water. That's a mistake. Plain water prepares your stomach lining, protects against acid, and helps your body better absorb nutrients. It also prevents you from over-drinking fluids after the meal, which can delay digestion and increase pressure on the bladder. Just 1 glass before breakfast supports your hydration rhythm without overload. Time number 3, around 11:30 a.m., pre-lunch hydration. This is where many seniors fall behind. By late morning, if you haven't had your 3rd glass of water, your brain may confuse dehydration for hunger or fatigue. A full glass at this time keeps kidneys functioning efficiently, regulates blood pressure before your midday meal, and prevents afternoon fluid overload. It's a critical checkpoint in the hydration timeline. Time number 4, 2 hours before dinner. This is one of the most important windows of the day. Why? What kind of water is best for seniors at night? By now you know that when you drink water is crucial. But there's another detail that most people, including many doctors, often overlook. The type of water you drink can affect how your body processes it, especially in older age. Let's be clear, all water is not the same. And for seniors, certain types of water may cause more frequent urination, increased mineral loss, or even mild dehydration despite drinking enough. Let's break down what kind of water supports your sleep, your bladder, and your body best, and which kinds to avoid at night. 1. Filtered, room temperature water, the best all-around choice. For most seniors, the safest and most bladder-friendly option is clean, filtered water at room temperature. Why this works? Cold water can stimulate the bladder and increase urgency. Filtered water removes chlorine, heavy metals, and irritants that might inflame the urinary tract. While electrolyte water is helpful during the day, especially after sweating or exercise, it can keep your kidneys active if consumed too close to bedtime. If you drink enhanced waters, do so before 4 p.m. to avoid overactivation of the bladder. 4. Tap water. Unfiltered, often risky in older homes. In many older homes and cities, tap water may contain trace amounts of lead from old pipes, chlorine, or even microbial residue. While it may meet safety standards, even small irritants can affect bladder tissue and increase nighttime sensitivity in seniors. If possible, use a basic countertop or under-sink water filter for all drinking water, especially in the evening. Final thought: think of water not just as a drink, but as a signal to your body. The type, temperature, and timing of your water intake tells your kidneys and brain how to behave. Choosing the right water helps calm your bladder, restore deep sleep, and protect long-term kidney function. Coming up next, We'll look at natural electrolytes that can actually help you sleep through the night, if taken early enough. Room temperature supports better absorption, especially in older adults with slower digestion. Tip from Dr. Broone: if you drink water in the evening, let it sit out for 10 to 15 minutes to lose its chill. 2. Avoid carbonated water or club soda in the evening. Many seniors switch to sparkling water for variety, but carbonation increases pressure in the bladder, and the bubbles can irritate the lining of the urinary tract. Even unsweetened versions may increase frequency of urination, cause bloating, or trigger acid reflux, which can further disrupt sleep. Reserve sparkling water for morning or midday only, not near bedtime. 3. Be cautious with mineral water or electrolyte water at night. Mineral waters often contain magnesium, which relaxes muscles, good, but also sodium and potassium, which can activate the kidneys, not good at night. By now, you've learned how hydration timing and water type affect your sleep, but there's another powerful piece to this puzzle, and it's one most seniors are never told about. Electrolytes, especially the right kind taken at the right time, can reduce nighttime urination and promote deeper, more restful sleep. Let me explain. What are electrolytes, and why do seniors need them? Electrolytes are minerals that carry an electric charge and help your body retain water in your cells, regulate nerve signals, keep your muscles and bladder calm, and balance fluid movement between tissues. The main electrolytes are sodium, potassium, magnesium, calcium. In younger bodies, these are balanced easily. But as we age, electrolyte levels become more unstable, especially in people who drink mostly plain water without minerals, take blood pressure or heart medications, have frequent muscle cramps or nighttime urination. Why plain water alone can be a problem. Bananas, small, preferably in the morning. White beans, coconut water, in moderation before 2 p.m. Warning: if you take kidney or heart medications, ask your doctor before increasing potassium-rich foods. 3. A pinch of sea salt or Himalayan salt, early in the day. Many seniors avoid salt altogether, but natural, unprocessed salts contain trace minerals that help prevent over-urination, reduce dizziness, support adrenal health, which stabilizes vasopressin production. A small pinch in water before 11 a.m. can restore hydration balance without harming blood pressure in most seniors. Again, check with your doctor first if you're on salt-restricted diets. 4. Homemade electrolyte water, morning use only. You can make your own gentle electrolyte water. 1 cup filtered water, juice of a quarter lemon, pinch of sea salt, small amount of raw honey or stevia, optional. Drink this in the morning, not late in the day. It hydrates your cells and provides trace minerals that help your bladder stay calm at night. Final advice: you don't need expensive electrolyte powders. Just a few natural food-based sources, taken early in the day, can calm your bladder, strengthen your hydration rhythm, and reduce those urgent midnight wake-ups. Next, we'll bring it all together in your final sleep strategy and when to speak to a doctor if symptoms persist. If you drink only plain, mineral-free water throughout the day, you may experience what's called dilutional dehydration. This means you're drinking enough fluid, but you're flushing out essential minerals, leading to muscle tension, bladder overactivity, and light sleep. That's why electrolytes in small, natural amounts can make a big difference for seniors. Best natural electrolytes for nighttime bladder control. 1. Magnesium-rich foods, especially earlier in the day. Magnesium calms the nervous system and helps the bladder muscles relax at night. Best natural sources: pumpkin seeds, cooked spinach, almonds, unsalted, avocado. Important: take these in the morning or early afternoon. If taken too late, magnesium can cause stomach activity that disrupts sleep. 2. Potassium from whole foods. Potassium helps balance fluid in and out of your cells. It also lowers blood pressure, which reduces kidney strain. Good senior-friendly sources, sweet potatoes, final sleep strategy, and when to see a doctor. Let's bring it all together. If you're over 60 and waking up to urinate multiple times a night, your body is giving you a signal. It's not just about aging. It's about disrupted hydration rhythm, reduced vasopressin hormone levels, overactive kidney and bladder signals during the wrong time of day. But the good news is this: you can reset your body's rhythm. And it doesn't require extreme changes, just smart, consistent habits. Here's your final sleep strategy, step by step. Drink your first glass of water within 30 minutes of waking. Start early to activate your natural circadian hydration rhythm. Space your water intake steadily between breakfast and dinner. Avoid water fasting all day and then overhydrating in the evening. Stop drinking large amounts of water after 6 p.m. Your kidneys need time to settle before sleep. Use filtered, room temperature water, not cold, sparkling, or tap at night. Your doctor can order a simple urine or blood test to rule out these issues. Final message from Dr. Broone. Getting older doesn't mean giving up deep sleep. You deserve rest, the kind that restores, heals, and energizes. Start with your hydration rhythm, reclaim your nights, and give your brain and body the rest they need without interruption. Thank you for watching, and I hope this video has helped you take your first step toward peaceful, restorative sleep. This supports gentle digestion and minimizes bladder stimulation. Incorporate magnesium and potassium-rich foods before 2 p.m. These support hydration at the cellular level and prevent bladder overactivity. Avoid high-sodium meals and late caffeine. These can irritate the bladder and increase urine production during the night. Maintain a regular bedtime routine. Consistency strengthens your hormone rhythms, including vasopressin release. When to see a doctor. While these strategies help many seniors, some cases require medical evaluation. Speak to your doctor if you wake up to urinate more than 3 times a night regularly. You feel extreme urgency or bladder pain. You see blood in your urine. You're also experiencing swollen legs, frequent thirst, or fatigue. Or if you're on medications that increase urination, like diuretics. In some cases, Nocturia may signal uncontrolled diabetes, sleep apnea, congestive heart failure, or bladder prostate disorders.